Okay, let's begin our next block of content. We've talked about chemotherapy basics, so let's move into cancer basics. And first we'll start with cancer epidemiology and kind of look at some numbers. So I want you to be able to rank cancer deaths as a cause of mortality in the United States, list the 4 most common cancer diagnoses in the United States, and describe recent and historical trends in cancer diagnosis and cure rates. So if we look at this data here, this shows us U.S. mortality rates. And this is identified by code. So the most recent is ICD-10. So when somebody comes into the hospital and they are said to have breast cancer, there's a certain code that goes along with that. So you're able to identify the cause of death for these people. So you can see here, if you look in the kind of the middle there, that the number 1 cause of death is heart disease, followed by malignant neoplasms. And if you look over time, over on the left axis, that heart disease deaths have been number 1 going back to the 1960s, and the heart disease death rate has gone down over time, whereas number 2 there, malignant neoplasms or cancers, has stayed relatively flat. And if you look at the far right, you can see that disease of the heart and cancer deaths have almost met. Heart disease is still the number 1 killer, with cancer being a close second as leading causes of death in the United States. And over time, you'll likely see cancer become number 1 as far as the most deadly disease state in America. Right now, it's still heart disease. So we see the answer to that question there, and that roughly 20 to 24% of all deaths every year are caused by cancer. So if you look on the left pie graph there, you see causes by in males, on the right females. You can see in both genders, heart disease is the number 1 killer, followed very closely by cancer. So you're talking 1 in 5 to 1 in 4 of every American dies from cancer. So if you think about how many men do you know, how many female do you know, you can pretty easily name 4 guys and 5 girls, and one of each of those cohorts statistically is going to die from cancer. So cancer is a very prevalent disease and a very deadly disease, and as we'll see later in the course when you look into specific cancers, many of these cancers are diseases of the elderly, and many of these folks dying from cancer are older. So if we look here, these are estimates for 2017. The blue bars are estimated new cases, and the red bars are estimated deaths. And these are updated every year based on the last year's data, and they kind of update and estimate what will happen in the coming year. So you can see here that breast cancer is estimated to have the most new cases at about 250,000, lung cancer a close second, followed by prostate and colorectal cancer. So those are the big 4, the 4 most common cancers diagnosed every year. The red bars are estimated deaths. So you can see there that while breast cancer is the most commonly diagnosed cancer every year, it is not the most deadly cancer. Lung cancer is the most deadly cancer. So more people die from lung cancer every year than it looks like if you added those up, almost breast, prostate, and colon cancer combined. And then you can see going down from the top 4, melanoma, bladder, non-Hodgkin's lymphoma, kidney cancers, leukemia, endometrial cancer or uterine cancer, thyroid, pancreas, cancers of the oral cavity, liver cancer, CNS and brain tumors, ovarian cancer, cervical cancer, testicular cancer, and Hodgkin's lymphoma. Looking at these numbers side by side give us not only which cancers are more common and therefore where we will spend most of our time learning about these malignancies, so it makes more sense to learn more about breast and lung cancer than it does, say, cervical cancer, which is much less common. But we can also look at the case rate and the death rate side by side, and we're pointing and looking at pancreatic cancer here, and there are almost the same number of cases and deaths each year. And what that tells you is that there is roughly the same number of people being diagnosed with the disease each year as are dying each year, and that's a sign that this is a disease that we do not treat very well and don't cure very well. In fact, pancreatic cancer is one of the malignancies that has a very poor prognosis. Our cure rates are not very good for pancreatic cancer. If you go about 4 or 5 disease states to the right there and you look at testicular cancer, you can see that there are not a lot of cancers every year, but you can hardly even see the red bar there because very few men actually die from testicular cancer. Very few are diagnosed, as you can see, but very few die. So it, along with Hodgkin's lymphoma, are two of the disease states where you do relatively well, and we do cure most people, the vast majority of people with testicular cancer and Hodgkin lymphoma. So let's look at trends over time. So this is data that the American Cancer Society puts together from governmental resources. And this is looking specifically at males. And on the x-axis we have time. And on the y-axis we have basically death rates per 100,000 people. So there, if you look at this and study it, a couple things will jump out to you. One is that lung cancer death rates spike about 30 years after World War II. So if you look back to 1941 to 45, a lot of these American GIs were given rations of cigarettes, and they started smoking, and then they came back, and they of course were addicted because of the nicotine content, and they continued smoking. And you see that the rates of that really spike. They start to go up right away, but they really kind of peak around 1975 to 1995 in that area. So about 30 years after World War II, we see the highest rates of death from lung cancer. That's the bad. The good, as you can see, is that about 30 years after we have the advent of our smoking cessation efforts, which were in the 1960s, you can see that lung cancer death rates begin declining. So they kind of peak in 1990 and then start to decline at a pretty steady rate thereafter. And again, if you've seen the television series Mad Men, there's a couple episodes specifically about tobacco, and it does give a good insight into what people knew in the 1960s and what we're beginning to think about the toxicities and the definitive link of cigarette smoking to lung cancer. We also see that stomach cancer death rates. Stomach cancer was the number one killing cancer in men in the 1930s, and we see that those rates go down to the point that on the left side of this figure, stomach cancer is the number one cause of death of the cancers listed. And on the very right side, you look at just above 2014, that light green or teal line for stomach cancer is now the least likely cause of cancer death of the 6 cancers listed here. And that has to do with the introduction of refrigeration, which allowed two things. One, it allowed Americans to stop relying on heavily preserved, smoked, cured meats, which are carcinogenic, and also allowed the introduction of fresh fruits and vegetables more commonly into our diets, which, because of their antioxidants, likely have an anti-cancer effect when consumed as part of a steady, healthy diet. So those are trends over time for men. Now if we look at females, we see a different picture in some respects, but also the same picture in others. The first thing that I hope you notice is that our y-axis is different. So our top value here is now 40 deaths per 100,000 people for females, whereas males, that top line was 90. So we're talking, even when you look at the lung cancer death rates that peak, maybe a decade after they peaked for men, you're still talking about half the total number of deaths in females as per males. We also see similar trends as we saw with men. So you see this big increase in smoking-related deaths, like lung cancer in females. And this starts, this increase starts a little bit later than what we saw with men. And we also see that the decline in death rates from smoking cessation happens a little bit later with females as it did with men. We also see a steady decline in death from uterine or endometrial cancer, as well as cervical cancer, which are linked together. And just from a raw numbers perspective, most of these deaths nowadays would be due to uterine cancer, not cervical cancer. They're lumped together here. But you see how those go down over time. This is likely due to increased surgical techniques, so more hysterectomies and removing the uterus. as well as successful removal of cervical cancer. Cervical cancer screening is really, really important at preventing cervical cancer death. But that won't explain what happened back in the 1930s and 40s. That was a later phenomenon, the Pap test for screening for cervical cancer. And we also see breast cancer death rates begin to go down in 1990. You might first want to say this is due to mammograms and screening. That's probably not the case. This probably has to do with not successful surgery, which was done even at the turn of the century, back in the 1900s, 1910s, 1920s, if you think back to Halsted and his radical mastectomy. Tamoxifen, which is a hormonal drug for breast cancer, was approved in 1977 and was approved in 1990 for treating women whose breast cancer had been fully removed by surgery to prevent it from coming back. And you see, really, with the introduction of tamoxifen in 1990, that rate of breast cancer started to fall. That's also when we started using chemotherapy to decrease the risk of breast cancer as well. So to summarize, cancer kills more Americans every year than any other disease, with the exception of heart disease. That's current day. There will be a time, probably in the not too distant future, where more people die from cancer than from heart disease. And again, that's a testament to how well that we've done in treating heart disease with aspirin, ACE inhibitors, statins, etc. Improvements have been made over time in decreasing cancer death rates. The number one cause of a decrease in death rate from cancer of any kind is going to be smoking cessation, followed by screening techniques. If you look closely at those figures, you'll see the colorectal cancer rates have started to go down recently, thanks to colon cancer screening with things like colonoscopies. And then, of course, introduction of drugs like tamoxifen and chemotherapy and different surgical and radiation techniques also further decrease death rates.